Good evening, everyone, and thank you for joining us for another episode of Protecting the Vision, sponsored by the National Optometric Foundation in conjunction with the National Optometric Association, our parent association, and we also are connected to our student association, the National Optometric Student Association as well. And together, we always try to educate and provide support and resources to underserved, underrepresented communities. And we also try to make sure that we're doing webinars like this to educate the community. And I want you all to tune in, invite your family and friends to this webinar because it is going to be the middle of the year knockout for you. We have a dynamic guest speaker that I'm proud to be on the webinar with, and I'll introduce him to you all later. But let me tell you a little bit about our foundation. The National Optometric Foundation is a nonprofit foundation here to financially support the National Optometric Association in various ways. We also partner with them when it comes to our annual conference, which is coming up here in July in St. Louis, Missouri. We're going to join with the NOA members, doctors, technicians, also faculty, staff, and also partners like VSP to provide eye exams to underserved communities, underrepresented communities, providing eye exams and partnering with great supporters like VSP, who's going to provide eyeglasses for patients that we see on that day. It's a great community event called Serve Where You Go. We look forward to doing that each year. We support the Student Association through scholarship support, trying to help them take care of some of the expenses that they have when they're in optometry school, being able to travel to the NOA conferences so that they can be around like-minded people and see doctors and be able to network with doctors in the profession of optometry as well. We also try to support our community leaders, providing resources for them to help educate their community and also to do programs within their community so that we are working together to strengthen our communities that's underserved and underrepresented. One of the things that we like to try to highlight are the 3 silent killers of vision, which is glaucoma, diabetic retinopathy, and hypertensive retinopathy. We do not want anything to rob you of your vision. We're here to help preserve the vision. And also we want to talk with you on other topics such as tonight. This month is mental health awareness. And we want to bring awareness to this topic because we know that it's okay not to be okay. But it's also important to make sure that we are encouraging people to reach out for help, reach out for resources, and make sure that we're reaching out before it's too late. And we want to thank you for joining us today for this important conversation that we're going to have on mental health awareness. Today is not about judgment. It's all about understanding, making sure that we're healing and supporting and educating people because mental health, somehow it affects all of us. It affects us through family, through friends, co-workers, church members, our community, and our goal today is make sure that we create awareness, remove the stigma, and make sure that we remind people that you are not alone. And so that brings me to introducing my friend, my brother, Dr. Jason T. Mahoney, who is a health and human specialist health and human services professional, a speaker, a consultant. He's a coach. He's an educator, community advocate with more than 20 years of experience serving individuals in child welfare, behavioral health, domestic and violence services, father engagement, homeless services, and community development. Dr. Mahoney serves as an adjunct professor with the social work department at Shaw University, where he is passionate about teaching, mentoring, and preparing future generations of social workers and human service professionals. He's deeply committed to helping students understand the importance of trauma-informed care, advocacy, leadership, and community engagement. As the founder of Crafted to Motivate LLC, Dr. Jason T. Mahoney provides coaching, consulting, trainings, workshops, and monthly empowerment sessions focused on helping individuals and organizations reach their highest potential. So if you need his services, please be sure to reach out to Dr. Jason T. Mahoney. His work emphasizes creating safe spaces for healing, growth, dialogue, and equipping individuals to become safe spaces for others within their families, the workplaces, and communities. A strong advocate for support groups and community healing spaces, Dr. Mahoney believes that connection, compassion, and conversation are powerful tools in breaking the stigma, promoting mental wellness, and supporting healing within individuals, families, and communities. And it is my honor to welcome my brother, who is also my college friend, roommate for so many years, to the webinar tonight to have this discussion with us. Welcome to the webinar, Dr. Jason T. Mahoney. Y'all show some love in the comment section. This is my brother, and I'm so glad that he's on this webinar with us tonight. Thank you again, Jason, for being here with us and being that ram in the bush.
No problem. Listen, Dr. Brown, definitely want to say thank you. I think today was very intentional and very purposeful. I do not believe that mistakes happen or things happen just for a reason. I just believe that I'm supposed to be here at this appointed time. It's interesting that, when you share with me that the speaker was not available, and when you reached out to me, I was like, well, this is a topic that I love to talk about. So I just believe that everything was ordained for this time and this purpose.
Perfect timing, because it happened this month. This is Mental Health Awareness, and this is a month that not only here tonight, but even over this past weekend, our church did a mental health fair where we had counselors on site. If people in the community came and they needed services, the church provided the resources for them to be able to sign up for services and get help, because we know that help is needed in the area of mental health awareness. And we want people to understand that it's just as important as physical health. Your mental health is just as important. And I'm glad that you're on to share with us. I'm excited to hear what you have to share with our listeners today.
Cool deal. And I must say that I'm very passionate about this subject. So in case, I get to the 8:00 mark, it's okay to stop me, jump in, because again, this is something I'm very passionate to talk about. So just let me know when you want us to get started, and we'll make it happen.
Excellent. So everybody tune in. Be sure to share this with your family and friends. Grab your favorite drink, get you some popcorn, listen in as my friend, my brother, Dr. Jason T. Mahoney, takes us through this topic of mental health awareness, providing education, support, and resources for those of you who need this service. Thank you so much. It's all yours, Doc.
Cool deal. Thank you. So one thing that I love to do, Dr. Brown, is I like to give out prizes, right? And so this is Mental Health Awareness Month. And so as you see, I have my green shirt on. I want like a mint green, dark green. But the green represents that, that information, that education, that awareness for mental health. So I'm just curious to know, and I know we have some people in the listening audience, and you don't have to do it now, but I want to give someone a $50 gift card. Okay.
Wow.
$50. Okay. For anyone, the first person who takes a selfie of themselves and post it on their Facebook page or their Instagram page and just put hashtag mental health matters. That's all. Okay. The first person who's listening, take a picture of yourself in the color green, post it on your Instagram or your social media page, and put hashtag mental health matters. Once you have done that, you can send that to the NOF, our website. You can go to their website and visit, but just get that picture to us somehow. or you can just screenshot it. But whomever gets that photo to us first, just get it to us and we'll make sure and get you that $50 gift cards. Again, we want to promote mental health awareness. So that's what we're going to do before we get started. So I'm going to jump in and hopefully some individuals drop some things in the chat or something to show that they're doing the work to spread the word of mental health awareness. So I'm gonna go ahead and get started. And so I do want to do a disclaimer to say that some of this information, it may trigger you. There is a video that we will be watching as well as a part of this webinar. And I want you all to know that if you feel triggered, please reach out to your local Department of Mental Health Services. You can do a Google and you can Google mental health services and support in my area. Do that and get access to the services, resources, and support that you need, because mental health is real and we must make sure and take care of it. So just in case anyone gets triggered from the information that we share tonight. So we're going to go ahead and get started. So again, as Dr. Brown introduced me, I'm Dr. Jason T. Mahoney. I'm super excited to be here. Trauma, mental health, overall well-being, that is the lane that I love to walk in, because we all need to ensure that we are taking care of our total health and not just our physical health, what we always talk about. So our agenda today is going to be very heavy. We're going to talk about a couple things. We're going to start on the airplane, and we immediately are going to go directly to understanding mental health. And then we're going to travel a little bit to the world of trauma and its impact. And then we're going to also visit the country that helps us understand what mental health is and what mental illness is. And then we're going to land the plane at healing and support resources. So we're going to start with understanding what mental health is. We're going to take a couple of detours, and we're going to land the plane on healing and support resources. And again, as people are watching, I believe in giving out prizes, engaging, even though we're on a social media perspective, but please put your comments in the box. I may have some questions. And if, again, first person who answers, you may have the opportunity to win some prizes throughout the day. So you must engage and participate in order to win. I guess that's the teaching in me. In order for you to get that grade at the end, you have to engage and participate. So looking forward as we dive in. So let's just start off with just a solid foundation of understanding what mental health is. Not going to read the slides. We'll be able to provide you with access if you desire them. But when we think about what mental health is, it is so simple to describe. It's really just, again, our emotional, our psychological, and our social well-being. And it pretty much it has an impact on how we handle stress, how we relate to others, how we interact, and how we also make choices in our life from that mental health perspective. And mental health is essential at every aspect and every stage of your life. So it does not matter if you are a baby just coming out of the womb or you're a individual that is 130 years old. Your mental health is essential with every aspect of your life, okay? Key components of mental health. When you think about mental health, the key components are your emotional well-being and your psychological resilience. And when we think about emotional well-being, let's just take a trip one day. When we get up out the bed in the morning, how many of us sometimes just feel tired? Monday mornings used to be my thing, right? I despised Monday mornings. I would get up on Monday and I was like, ugh. It's another Monday. I despised Mondays. And what was happening, though, as I was despising my Mondays, I would end up having like this terrible Monday every single day, because I was getting up already with the mental behavior, mental thought process of I despise Mondays. For the past 3 years, I've now changed the mindset of, you know what? I'm looking forward to this Monday. This is the day that I have an opportunity that I did not see before. It's the day that I can make changes, make a difference, meet new people, gather with individuals. And so what happened is I had to shift my mindset so that my well-being on Mondays would just be a little bit different, okay? And it's also the psychological resilience. And when we think about resilience, let's think about a situation that you've been in and you've been able to achieve it and bounce back, right? So your mental well-being or your mental health provides you with those tools and those strategies to really help you bounce back. So when we think about the emotional well-being and psychological resilience, That's where that mental health piece comes from, being able to develop those resilience to help us navigate through life in those difficult situations. Okay. Also, another key component of mental health is social connections and healthy coping. And we're going to talk about social connections a little bit later in depth. But again, with our mental health, always tell people, and I even had to tell this to myself, social connections are extremely important. But if our mental health is not where it needs to be, our social connections can have some challenges. Our family connections can have some challenges, right? Our connections at work can also have some challenges. So when we think about social connections and mental health and the relationships, if we're not taking care of our mental health, sometimes our social connections can have some challenges, as well as our healthy coping strategies can have some challenges as well. And so we'll dive a little bit deeper into just understanding mental health as a whole. But when we think about the idea of our mental health and our physical health, I want to let people know that these are two things that walk hand in hand. Okay. When you think about mental health, I want you all to think about your own physical health, right? We go to the doctor we should, okay? We go to the doctor each time to check, our blood, our pressure, all of those things. And because, this is by the National Optometric Foundation and the National Optometric Association, we get our eyes checked, right? And so we always take care of our eyes, our physical, and those things. But what do we do to take care of our mental health? I wanted you all to just pause for that for one moment. And if you all can, put in the chat, what are some things that you do to take care of your own mental health? Again, mental health and mental illness, they walk hand in hand. And we want to make sure and be able to help you show how they walk hand in hand, but then also how they walk alone as well. Your mental health falls in the same domain as your physical health, your eye health, all of those things. Thank you. Someone said they would go to therapy. Absolutely. They all walk hand in hand. And so we must be willing to have these conversations. But if we can be honest, Dr. Brown, I know you're not on, I know you're in the back of the studio, but if we can be truly, truly honest, we sometimes, Dr. Brown, fear talking about mental health because there's a stigma that's associated with mental health, right?
That's right.
And I can say this, that specifically in the African American community, we shun a lot of times mental health, and there's research to talk about this. So I'm not just pulling things, out the air, but a lot of African Americans in the African American community, they do not address their mental health, right? A lot of times we've been taught to suck it up, be strong, be courageous, be mighty. And when we think about in that community, how we always say, being stronger and those kind of things, but our mental health is struggling. Just like your physical health, your mental health it must have a tune-up as well, okay? And so we're going to dive a little bit deeper into mental health, but I really want us to go into understanding what mental illness is. But mental health really and truly is the idea or understanding, just like your physical health, your eye health, your ear health, when you go to an ENT doctor, when you go to an optometrist, you're taking care of your physical well-being, but also how are you taking care of your mental health well-being? And I actually had a conversation with some family members over the weekend about mental health, and I hope some of them are joining today, because we actually had a really deep dive into understanding the relationship between mental illness and mental health and how we need to walk with those things. Okay.
Right. So, and Jason, I just want to add, many times people are walking around, I saw, and I talked about this too. People are walking around looking as if they are okay, but really internal, they're dealing with a lot of stuff. They're dealing with a lot of stress. And, there are certain things that can trigger and push that point of stress up to the top, and it can cause, some things that could have been prevented from happening. So I just want our listeners to understand that we're trying to provide this education so that you guys will understand and recognize what mental health is, and also knowing that it's important to get your mental health checked. Just like Dr. Mahoney was saying, we go to the doctor to check on diabetes and high blood pressure, and we go to get checked for our annual. But what are we doing year after year for our mental health? So just think about those things as he continues to talk with us about this.
Interesting, Dr. Brown, something that you shared. You said that individuals are getting up every day and they're walking around with carrying all this weight. And so if I can use this analogy, when I was younger, my mom would always say this analogy when we were talking about something else and sitting here thinking about something you just shared. My mom would often say when we were younger that if you dress a pig up and put lipstick and an outfit on a pig, it's still a pig.
Still a pig.
And so a lot of times we're struggling every single day and we're at our breaking point and we're dressing nice, we're looking nice, but we are not feeling nice at all. We are so overwhelmed and we have so much shame, and we have shame because we have made such stigma about having a conversation about mental health. And so we continue to carry all that. And I tell people that is such a heavy burden to carry, right? You know, somebody can say, you know, I have diabetes, right? We say that all the time. You know, I have diabetes, or I have high blood pressure. And we say these things like it's a badge of honor, right?
Right.
But we go to the doctor to address them. Or you know, in optometry world, we may say, you know what, I'm nearsighted or I'm farsighted. I may need to get some glasses. And we give ourselves pride on going to the doctor, going to get those glasses. But when it comes to our mental health, we are so ashamed to say, you know what, I'm really having a bad day today. That impacts your mental health, okay? Right. So let's go to mental illness. A mental illness, it refers to, and I want to read this because this is really important. A mental illness refers to conditions that affect thinking, feeling, mood, or behavior. These conditions are more common than many realize and can affect anyone regardless of age, background, or circumstances. So let me just put a pause here and say this. It does not matter who you are, how much money you have in the bank, where you sit in an organization, where you sit in your church, where you sit wherever. Mental health and mental illness does not have a name, age, or gender, period. Okay, so as my grandfather would say, you know what, let's get off the horse so we can get some help. Okay, right. It doesn't matter where you are in life. It does not matter. Mental health, mental illness can have an impact, and there are a lot of common mental health conditions. I encourage everyone, if you have never heard of the DSM-5, please Google it. Google is your best friend, but also still research. Google the DSM-5. It is pretty much a diagnoses manual to help individuals, therapists, mental health providers be able to give the mental illness the diagnoses, okay? And so some common mental health conditions, depression affects over 280 million people worldwide, okay? Over 280 million people in the United States and beyond are impacted by depression, okay? And I just want to put a little pin here to say seasonal depression is depression. Mm-hmm. When you're going through grief and loss, you lost a loved one and you then begin to isolate yourself and shut yourself down and can't function and think. Those are some situations that have caused some seasons in your life. And because of that, again, it's important to reach out and get the support that you need, right? And then anxiety disorders are the most common mental illness. Again, reach out to see what anxiety is, right? And Dr. Brown, one thing that I like to do is I do not like to use big words, okay? Right. And because my philosophy is if I can't get down to the level of the person that I'm helping for them to understand, then it's null and void, right? So when you think about those anxiety disorders, right? I always say my grandmother, when we were young, and she would always say, well, such and such got to take a nerve pill. And Dr. Brown, I'm sure you've heard, people say that in
Oh
your
yeah,
family as well. You got to take
absolutely.
a nerve pill, right? So here
Absolutely.
I am as a child, right? And I remember my cousins, we would get together and we would play, and we would have like these little candies that would come in a little dispenser, and we would be having fun. We'll say, I'm taking my nerve pill, right? And so we will be having fun, not understanding what that meant. Okay. But as adults now, I always try to tell people, let's use the right words. Okay. This person is not taking a nerve pill. This person has anxiety. And because of that, they're seeing a psychiatrist or they're seeing a therapist, and they're receiving the medication that they need to support them, right? PTSD can develop after experiencing trauma when we think about those in the military. And let me say again, growing up in the rural South, we would hear our family members coming back from the military and they will say, oh, I have PTSD. And growing up, I only thought that PTSD impacted people in the military because here I am.
Me too.
Right.
Me too. Yes.
And here we go, college roommates, and we thought this, right? Because that's all we knew, right? But we didn't think PTSD when we heard about one of our family members that was in a car accident, but she's afraid to drive.
Yeah.
And then I would hear family members be like, I don't know why she's scared to drive. She just need to drive. No, she's suffering from PTSD, right? And so we have got to be able to have these conversations in our communities. Bipolar disorder causes extreme mood shifts, right? And so sometimes we may say, oh, she up and down, he up and down. I don't know. No, that person may have a bipolar disorder. And we're not saying something is wrong with them. What we're saying is let's get them help, right? The same way, if you have diabetes, you don't want anyone to talk negatively about you about having diabetes. You know how when people wear glasses that you want to be picked at being called four eyes? You did not. So when someone has a mental health diagnosis or mental illness diagnosis, let's be fragile. Let's respect them the same way that we want to respect someone that's diagnosed with breast cancer, someone that is diagnosed with bipolar. We want to still respect and honor that person as a human being. And the reason I'm saying this is because it ties all together. Because when we do these things, these negative statements toward people, we are further penetrating their mental illness. We're further creating spaces where they do not want to talk. We're further creating spaces where we're not being safe spaces for healing. So if we really want to understand mental health and mental illness, the first key takeaway point is fix your language. Okay, fix your language. Point number one, when it comes to mental health and mental illness, fix your language. Stop calling people crazy.
Right.
Stop saying they have a demon inside of them. Stop all of that, right? Because we have to be, in order for people to be healed, we must start utilizing the right terminology to help people out, okay? And someone has said, and I want to respect this, they said, Dr. Karina, she said, ADH are over here, so this close to my heart. Thank you for organizing this. Absolutely. And again, thank you for your transparency and your honesty, right? And one thing that I always tell people, once you understand what you're going through, then you can address it. If I make a decision to never understand what I'm going through, I can't address it. And as people are listening, I am sure I talked to so many individuals about this. How many people in your family or has someone in their family, Dr. Brown, where when you were growing up, there was a cousin that will always stay in the back room? Right. Or there was a relative that's always in the back room, right? And for us, they would our families would paint a picture of that family member in the back room. And then me being curious as a child, I used to always want to know, who was this cousin? I want to be this cousin because I needed to know, why are you sitting in this back room by yourself? Why are you people out the blind? Let me love on you, right? It's okay. We're going to bring you out the back room and sit you in the living room with us because you are a part of the family.
That's right.
You are not a backroom person. So if anybody right now has a family member that is just sitting in the back room, go there and love on that family member. Bring them out. It's okay, right?
That's right. Right. So, and one of the things, I wanted to highlight too, Dr. Mahoney, for our listeners, just to understand that not every struggle that people are going through is visible. You got a lot of people who have train themselves to smile. They're walking around in public smiling, but they're really suffering in private, and those are things that people are going through on a daily basis. So
Absolutely.
much to the point, and you may touch upon this later on. It's another topic that we don't like to talk about, but so much to the point that it leads to depression, and then depression leads to suicide. So we need to make sure that we're very careful, as he's saying, watch your words, watch your language, towards people, because we don't know what they are going through internally. They're suffering.
Absolutely, 100%. Because it was so crazy because, and I'm using not crazy to a person, but just the kind of like the situation I found myself in, a unique situation, is I have somehow become evolved to being this person. I've always kind of been this person, but now I'm kind of like I'm owning it, is not owning it more. Is people love to download their stuff on me. And what was interesting about it was I realized I was, and when I get into trauma, we're going to talk about that, but I realized I became what I call a vault for so many people. And working in health and human services field, of course, that's my job. But then family members, friends, I became a vault, and I appreciate that I'm a vault for them, right? Because somewhere along the line, they could not talk to their mama. Somewhere along the line, they couldn't talk to their father. Somewhere along the line, they couldn't talk to their family member. But guess what? I created a safe space for them to be able to have a conversation with. But what I did not realize, Dr. Brown, was I was becoming that vault, but I did not have an outlet for me to talk, right? And so I began to get heavy with some stuff, right? And I had to realize, wait a minute, I now have to find a place for me to have these conversations, right? Because again, I'm no safe space for so many, and I'm okay with that. If somebody want to call me and talk with me about this situation, I am so okay with that, because I always tell people, you never know if you're the lifeline for somebody else.
Exactly.
You never know if that person is at their breaking point and they run into you. That's why I tell people, just treat people nice. If you're in the grocery store and somebody's having a bad day, treat people nice. The cashier that is ringing up your items, you do not know what is going on in their home. You do not know what is going on with them mentally. Everybody that you encounter, we are all carrying a story. And we must be willing to validate that person. And this is where the mental health stuff comes from, right? And that mental illness. So when we look at mental health, everyone has mental health. Just like physical health, it exists on a spectrum and it goes up and down. Just like they always say, when you turn older, your back may start hurting a little bit, right? When you turn older, you may not be able to walk up and down the stairs. So your physical health is now being impacted, right? And so also when you get older, your mental health is being impacted as well. I was reading a study not too long ago from an individual. She was about maybe 70 years old. I can't remember all the nuances behind it, but she talked about growing older. Her husband had passed away. Her kids had moved away. So it was just her in her community. So she had the empty nesting syndrome, right? And she would talk about just going home, sitting in the house, and all. She was depressed.
Yes.
How many people do we know that have lost someone either through death or lost someone through the person grew up? And honestly and truly, Dr. Brown, somebody who is going through a divorce. That is a traumatic situation. And all of that can impact your mental health.
Yes.
Okay?
Yes.
And so
and people feel, Dr. Mahoney, I'm sorry, and people feel lonely. That's the word out there. When they're having so much loss, they don't have that spouse around, that voice that used to fill the rooms. It's no longer there. That loneliness, it can be so overwhelming. Right. It can be so overwhelming. So sometimes, parents, you need to send those grandbabies over to spend the weekend with grandma. so that there's a voice that's other than her voice in the house. There's laughter. There's the sign of youth, flowing through the house again, to give grandma or grandfather, some joy. I just want to throw that in there because I just feel people miss that a lot when they move away from mom and dad, and the grandkids are no longer around. They move to a different location, a different state, or that person lost a loved one. As you said, loneliness can easily, come into their home, into their mind, and they need that support when that happens.
Absolutely. And you said something really important, and I'm actually going to come back to it about sending the grandkids to the grandmother's house, but I'm going to touch on that a little bit later.
Okay.
And so with mental health, good mental health does not mean the person is happy all the time. Okay. I'm one of those people. I am typically happy most of the time. But I do have my days where I'm like I said, on Mondays, right? Or if I had a stressful day at work, I have to, decompress, because if I don't, I'm going to impact my mental health, right? Just like if you go to the gym to take care of your physical health and to decompress, same concept. Okay. Now, mental illness, here's where we get into the difference. Okay. Your mental health is your physical health, your emotional health, all those things that go around there. Your mental health refers to a diagnosable condition that significantly impacts your thinking, your mood, or your behavior. As mentioned, this is depression, anxiety, PTSD, bipolar, and others. Mental illness is not a character flaw or a weakness. If somebody can just type that and put that on the screen besides Dr. Brown, just please put mental illness is not a character flaw or a weakness. It is a health condition that can affect anyone, regardless of age, background, or circumstances. What are you saying, Dr. Mahoney? In other words, just because a person has a mental illness does not mean that there's something wrong with them. And Dr. Brown, I'm getting passionate about this right here. And I feel like
Okay.
what have you, because here's what we have done in the community, right? In the community, we have made people shamed to have a mental illness. And because if I'm shamed of my mental illness, I won't get treatment, or I'm afraid to share it because there may be a statement about me that I do not know how to handle, right? So we have caused people to go into isolation because of that, right? So if you're right now listening and you're struggling with something from a mental illness, there is nothing wrong with you. Just like if someone says, I have diabetes, we will say, oh my God, well, how can we help you? What can we work through? I got a garden. So if somebody says, I have a mental illness and here it is, then we need to be a safe space to help that person. We have got to stop shaming people just because of a mental illness. Imagine if there was a commercial that shamed everybody that had that wore glasses. Therefore, then you'll see a decrease in people seeking services from their optometrist, right? And so when what happens is, if we want to be healthy people, healthy communities, let's stop shaming and let's be able to be a support, okay? But if you have that mental illness, listen, there's hope. With proper support, treatment, and an understanding, people with a mental illness can lead a fulfilling and meaningful life. Let me explain. Someone who has lost their leg, okay, there's technology and equipment out here that now you can actually create a leg that looks like the person's legs and attach it to their body, and they can just live a normal life, right? Same thing with mental illness. If you get the right therapeutic regimen, therapeutic treatment, you can continue to live a natural and okay life, okay? So the mental health continuum, let me talk about this. Mental health continuum is when you think about a timeline, okay? Throughout your life, your mental health, it will kind of like ebb and flow, right? It just like, we wake up in the morning like, wow, my back is hurting on Monday. We may wake up on Wednesday and our back feels great. On Thursday, maybe something else. So we may need to go get our back checked out. So with the mental health continuum, same concept. The first part is thriving and flourishing. Those are people at that stage of that mental health continuum. They're just excited people. They feel energized, connected to life. They're just energetic people. Now let me do a testimony here, right? So I am a person that I'm upbeat, I'm happy, I bring energy. Okay. I really stay a lot in the thriving and flourishing. And the reason I stay a lot in the thriving and flourishing is because I pretty much step back and look at situations and say, can I change this? If I can't change it. If I can, then I'll try to change it. And so, but we wake up and we're happy. So that thriving and flourishing are people who are just happy-go-lucky. Now, I was in a situation one time where I went to and I'm just being transparent in this conversation because mental health is important for me. I went to Sunday school one morning, and I was so just energetic that morning. I was so happy that morning. I don't know why, but I was and I went in Sunday school and I was talking. I walked in and I was just so energetic. And someone said, I can't take this, Jason. I can't take this. You just bringing too much energy this morning. You just need to just shut it down and be quiet, boom, 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 because they were upset. So my feelings were hurt because I was like, I didn't do anything, right? But my energy. So then I sat down, I engaged in Bible study. And so I got my resilience back because I read the scripture. This is the day the Lord has made. I'll rejoice and be glad in it. So I raised my hand in Sunday school. I said, wait a minute, I have a question. When I came in energetic, but I was told that I was too much. But then in Bible study, we're studying the scripture. So help me understand, if I'm thriving and flourishing, can I not be happy? And so I want to use that example is when somebody is doing great mentally and healthy, we may see that energy is so great and they're just happy. And then there's some people whose energy is not there. So we have to make sure and be able to have conversations when people show up as a safe space. Again, that goes back to the idea of, are you a safe space for somebody? Ask that question yourself, okay? And then the next continuum is you have people who are coping and managing. Been there as well. I go there when there's a lot of stuff on my plate, right? And I have to really cope and manage. I have to say, okay, let me get a to-do list. But this is the middle ground that represents everyday functioning with normal ups and downs. Life is not going to be a crystal stair every day, as Langston Hughes said in his poem, Mother the Sun, okay? You're going to have some ups and downs, right? But when you are in tune with your mental health, you're able to say, you know what, how can I manage this situation I'm going in, okay? Then you have that last continuum of struggling and needing support. This is when individuals are really struggling. They're in situations, and you may see them withdraw from people. You may see them experience persistent negative emotions. Think about somebody who's always angry, who's always bitter, who's always causing some chaos. And so those individuals, again, we're not diagnosing anybody. We're not giving anybody a diagnosis, right? Tongue twist. I'm from the South, right? But we're not giving anybody a diagnosis. What we're doing is we're just pretty much stepping back and saying, okay, what's going on with Miss Beulah today, right? Let's think about somebody who you know, and they are pretty much, they're just there in that struggle and in need of support. Are you a safe space to walk up to Miss Beulah and say, hey, can we talk? How can I support you? Literally yesterday, one of my friends just texted me. We were having a conversation and they texted me. And for me, I was so grateful to be available in that space at that time, right? And so because they were at that struggle and needed support. And here's the thing. When you need support, it's okay to ask. But here's the challenge, Dr. Brown. I want you to come in on this. Some people do not have people and spaces and resources that they can go talk to. Right. Because, and remember I told you I want to circle back around to something you had shared. Let me hold it. Let me get to intergenerational trauma. Let me get to that. And then I'm going to bring you back on that. Okay. But struggling and needed support, this is so key. when you find yourself. So what I would like for everyone to do is do a self-assessment, right? This is another thing. Just like how we tell men and women to do breast cancer exams, right? Because breast cancer impacts both men and women. You do your own exam. So what I would like for everyone to do when you have a moment, find out where you are right now in this space. Are you thriving and flourishing? Are you happy? You feeling good? Are you coping with situations and just managing that middle ground? Or are you just at a place where you don't want to get out of the bed in the morning, or you are showing up with a mask to yourself? Not a mask to somebody else, because that's their business. But do you have on a mask where you're hiding your own self from yourself? Okay. Understanding trauma. So trauma is my baby. I love trauma. Talk about trauma, train in trauma, because trauma is real. Trauma is a deep response to a deeply distressing event, overwhelm our ability to cope. It can result from a single incident or ongoing experiences. And trauma can impact your body, it can impact your mind, it can really, really have some negative impacts on you. Okay. Now, I do want to again put this disclaimer out here. I'm going to really go in deep about trauma for us to understand it. So again, if you need assistance, put it in the chat. If you have some questions, put them in the chat. I did see someone question. I will come back and get that about the hereditary of mental illness. But we're going to dive into something I love to talk about is understanding trauma. So there are different types of trauma. Okay, your first type of trauma is what I call your acute trauma, right? So I will use myself, always like to be transparent. So acute trauma, that relates to the idea of when you find yourself in a situation, it may be like a one and done. Okay, so when you think about your one and done trauma, let's think about you're in a car accident. Okay, it was a really bad car accident, and things really kind of went belly up, and you're just really trying to find your way out. Okay, and you had that once in a lifetime, that acute trauma. So I'm gonna pause, and I just want everybody to put in something that they have gone through. If you feel that this is a space where you can put it on, put it out here. But somebody tell me an acute trauma that they've been in. It's like one of those things where it's maybe a one and done, a car accident. It may be a situation where you fell, where you were riding a bicycle, right? And you fell off your bike and you experienced that one and done kind of trauma piece. Everybody put in there, if you feel comfortable, a trauma, acute trauma that you've had to experience. If anyone feels so to do so, we're here. Absolutely. Major surgery. Absolutely. Oh yeah, I do remember that. I do remember that when you had that. Anyone else? Anyone else that wants that feel safe to share? I think this is why I got to get in and do that support group so people can feel safe. I know this is a large piece here. But again, when you think lower back pain, so I collapsed. Oh my God, right? So let's think about how this impacts you, right? So if I can use that example, right? So the lower back pain, so you collapse, right? So what happens is, let me even go with trauma. When we find ourselves in those situations, lower back pain, so the next time you have a lower back pain, you may feel, oh my God, am I going to collapse? What is going to happen, right? So again, when we talked about the trauma before in the previous slide, it affects affects individuals differently and how they process things and process situations. And so we think about those acute traumas, it's a single distressing or overwhelming event. A car accident, if you've been in a robbery or natural disaster. I remember at 8 years old, in 1989, Hurricane Hugo hit South Carolina. Okay, I was 8 years old. That was my first time ever experiencing a hurricane, to my knowledge, and it was so devastating. Right, I heard the news about people dying, so it was so devastating. So now, at my grown age now, I still get fear when I hear of a hurricane coming, because I remember at 8 years old what happened. But guess what? Because I have done work and heal and those kind of things, when I see a hurricane now, let me get my mind together. Storm is coming, right? What do I need to do to prepare for this storm, right? But again, that's because I made a decision to address why am I feeling this way when that hurricane comes on the news, okay? The next piece of trauma that we're going to talk about is, I'm going to come back to complex, but I want to go to community trauma. So when we think about community trauma, it's pretty much things that are going on in our community. So if you are in a community where there's gun violence, racism, and discrimination, that is trauma, right? If you've been in an experience where you had to experience racism from someone, if you had to experience police violence, lack of community resources, those are those community traumas that kind of like come in. What's going on in your community? So I ask people when I'm having a conversation with them, tell me about your community, right? What community did you grow up in? And once you really kind of understand how community trauma works, that's when now you can do work to address a community trauma. So when you think about gun violence, what can you do in your community to address this? Because that 8-year-old, that 10-year-old, that grown person who's in that community and are experiencing community trauma, they need help. How do we help these communities? Another piece is complex trauma. Complex trauma typically occurs with a person over time, right? It's one of those things where it may be ongoing. And a lot of complex trauma starts from, drum roll, a person's childhood, okay? Dr. Brown, come on in, because this is where I really want to talk to you, right? And we're on slide number 9, and I got a video, and I got 19 more slides, just playing. So we think about, I tell you, I love this, so it's a lot. So we think about the complex trauma, childhood abuse, abandonment, chronic instability, growing up in fears. This is where we get our adverse childhood experiences stuff from, right? And so you said something earlier about the child taking the kids and taking them to their grandmother's house and letting them play with their grandmother, right?
Yeah.
Okay, all right. This may step on some people's toes, but we have to be real, okay? There are some family members that will say, I do not want my children to be around my parents or my brothers, my sisters, or my cousins. So some families isolate from their family and create their own family. Why do people do that? Why would people do that, Dr. Brown?
Listen, I think that is so different. And I think it takes that child away from learning from grandma and grandpa. You know, there are things that grandma and grandpa can show and teach your children that you will never be able to do it. Because one, grandma and grandpa, they're older than you, so they have more experiences and wisdom to be able to share, and you haven't quite gone through the things that they have to be able to share that. And I also think that people think that because of the language that may be used, you know, around grandma or grandpa's house at a certain education level, people have said that. And that's why they don't want their children visiting too long or at all with grandma and grandpa. But at the same time, I feel that it provides the company that is needed from grandma and grandpa. You know, I think it provides that sense of care and not feeling that you're all in this world alone, and grandma allowing all of this loneliness to settle in because no one is in the house, no one else's voice can be heard. And also, I think it helps also to give them, you know, some type of outlet, so they're not just walking around the house talking to themselves. You know, that's support. But one of the main things that I tell my mom is that it's good for her to have people around because it keeps the brain stimulated. Mm-hmm. It keeps you thinking about things. You know, you don't want that brain stimulation to decrease, and you start having more deeper mental issues going on because of that.
So absolutely, I love that. And that piece, what you just talked about, is being able to help children connect to their families as a safe space, right? But I want to go, I just want to go a little deeper and push that just a little deeper, okay? An individual who is now an adult with their family sometimes may not want to return back to their home because of complex trauma or community trauma. Hypothetically, let's say mom and dad, domestic violence, substance use, and abuse the kid, right? And so now this child grows up, goes through their healing, go through what they need to go through, and then now they have their own children. So sometimes, and I think someone put it in the comment, I think it was Noelle, and yeah, absolutely. And so sometimes family members or friends do not want to bring their children around because they grew up in a complex traumatic home environment where they do not want to show up, and they don't want their kids to endure those things, right? So that's why I believe in an intergenerational approach to healing, right? And what I mean by that from the traumatic perspective is I do not believe that we can heal the children alone. I believe that we should have a model that, number one, when it comes to adverse childhood experiences and this trauma and all of those things, is number one, is that we have to make sure and put prevention mechanisms in place to prevent children from being abused. Okay. Mm-hmm. Then put mechanism in place for adults who were abused to be healed or who experienced trauma. And we have to put in a community approach to heal the community, because that's the approach where you're healing the community, you're healing generations before, and you're protecting children, right? So what you're doing a whole continuum to be able to protect the community. But see, what happens is grandma and granddaddy, the older generations, they sit in their stuff, right? Mm-hmm. And so then you have a newer generation who do not want to have that life anymore. And so now what has happened is now we have fragmented the family system. We fragmented the community because some people want to heal, some people do not want to heal. And then some people are still making the notion of mental health, right? Mental illness. And I always tell people, I was talking to an older more seasoned person a couple of weeks ago, and we were just talking about mental illness, and it was like, oh no, I just talked to the good Lord, boom, 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 boom. And I just deal with it. I said, that's great. I said, well, that's your coping mechanism. I said, but everybody deals different. It was like, no, that's not real, boom, boom, boom. This is all we need to do. I said, okay, let's use this for an analogy. When you go to the doctor, in the office, your doctor's office, there are smiley faces and says, what is your pain scale? I said a pain level 5 may be a pain level 2 to somebody else. So we all have pain levels at different levels. Same thing with how we respond to trauma. Because again, earlier I talked about psychological resilience, right? We all have our own thought process, situations, in how we handle pain. We also have the same thing about how we handle trauma. So we must be mindful that yes, we do want the family systems to come together, but we must also be mindful that that complex trauma, those kids that grew up in that abusive home, sometimes they grow up, they do not want to be reminded of those situations. I worked with, again, lots of people download stuff. And it was one person who I knew in my life. I for well over 30 years, I will be completely honest with you, Dr. Brown, for well over 30 years, I despised this person. I did. They were an older family member in my own family, and I despised them, right? Because of how they treated us when we were kids. Okay.
Right.
But now at my grown self, I actually have one of the greatest relationships with this person, right? And I have a good relationship with this person is because now I understand their childhood, right? Mm-hmm. They were born during a time where you did not seek treatment. You did not. So now at this age, they are healing. And so now I'm walking with them on this journey, and it's so beautiful because I now understand why they did what they did when they were younger, right? When I was a child, and how they responded to us, right? So now I understand it. And this is what all this, when we think about the types of trauma that I endured, I was bullied, right? I was bullied when I was in school. And until I understood what I call my acute explosions and what I call my trauma responses, because now as an adult, sometimes when people come at me some sideways, sometimes I spaz out, right? And spaz out meaning that, I'm gonna come back at them, right?
Right.
And the reason that, but then now I understand that's a trauma response. That's a trauma response because when I was younger, I did not have that inside of me to do that, right? So now it's almost kind of like as an adult, you're not gonna get me. But I had to learn how to understand those were traumatic situations I endured, whichever spectrum it fell on, contract, complex, community, whatever it fell on. And so when I interact with people now and I see them do a behavior, I now step back and say, let me love on this person because they have not healed from when they were 7 years old. Right. And so I love to just sit and talk to people and say, let's heal together, because when we heal together, we can truly help future generations. Okay.
Right. Right. And Jason, it's important that we heal together. It's important that we seek counseling and therapy and sometimes just writing in a journal. I got a friend who did her journal, in her book, SOAR, where she talks about, just writing a daily journal, and setting boundaries and having positive self-talk with yourself, because if you don't help yourself, you can't help others. You can't, what is that thing is, you can't pour from an empty cup, so you got to get that help in order to be able to help others.
Well, and actually this person actually just asked a really good question that goes to your help, right? So they asked about how can complex trauma with family affect how we partner friends romantically? Really good question, right? And so that actually the answer's on this slide right here, which is recognizing your trauma responses, right? And so when we think about our trauma responses, those are pretty much ways that we show up, okay? We show up. And let me put a pin here and say that once we begin to dive into understanding mental health and mental illness, your relationships with yourself, your people, your family, it will change, right? It will change for the good, but you have to be willing to understand it. So to go to that question, this is how I may show up, right? So recognizing trauma responses, right? Remember I talked about, like when somebody would, come at me sideways, and I like to use these languages or what have you, because I want us to talk like we talk in our family, right? Because I can use clinical terms and all of that, but let's get natural, right? So when someone comes at you sideways and you've seen somebody be like, why is she doing all that, or why he's doing all that? That's just taking too much. And I'm like, you don't understand what triggered in that person. That may have triggered something, right? And so we look at our recognizing trauma response, right? So the first thing that it could show up, and it says at Noel, but I'm not sure what's your name, but at Noel, it says the first one is a fight response, right? Somebody that always, we know when they spaz out, they go angry, they don't go get really aggressive towards people. They got to control everything, right? Because somewhere along that person's life, they did not have control. Right. And so they had to protect themselves because they did not have control. We see a lot of this that show up in individuals that may have experienced traumatic sexual abuse, right? And so, or they may be promiscuous, right? And so that's why we tell people never judge somebody based on what's going on in their life, because you don't know their story, right? And so with that fight piece, so you show up with a partner, your partner may do something that reminded you of a trauma. So that's a trauma trigger. So next thing you know, now you argue with your partner's like, I didn't do anything. But that's why it's so important. Again, thank you. That's why it's so important when you have these conversations, right? Make sure it's a safe space. Make sure that person is safe for you, right? To have these conversations, because you do not want to end up in a relationship with somebody and you didn't know that, they spaz out when they when the water's cut off or because they've been growing up in a household, what have you. The next recognizing trauma response is flight. These are people who avoid situations, who have anxiety, who overwork, who pack their schedules up, right? So they can avoid dealing with the situation. Now,
Right.
let me put this right here. Please do not go out diagnosing people, because that is not what we're doing. Okay, what we're doing, we're just giving a general overview of the information. Now, we may have our cousin Louise, who is always working. Louise may be working on a goal. Louise may be trying to get a new house, right? Louise may not be responding from a place of trauma. That's why it's so important to have a conversation, right? Do not prejudge cousin Louise, right? Cousin Louise may be trying to get her water bill paid, and she may be working extra hours. She's not covering up something. She's working extra hours so she can get her water bill paid, so she can get her new washing machine. Okay. So the next response may be freeze, right? Somebody may emotionally shut down. And these are people that I really worry about a lot. I worry about everybody, but those people that freeze, because these are people that go into isolation. And when a person is in isolation, that gives room for negative self-talk. I didn't talk about negative self-talk here, but if you all want to Google it, Google negative self-talk. Everybody experiences negative self-talk, but we have to, change that mindset with positive self-talk. Okay. So that freeze is, the emotional shutdown and feeling stuck, like I can't move, right? And then the next one is fawn. They should have called it dawn, like the dawn or doe, but it's people pleasing, fear of conflict. So these are people that are always trying to please everybody. They're yeses. They're yes ma'ams and no ma'ams. They don't like conflict at all, right? They'd rather sit and suffer versus address something that is bothering them, right? Dr. Brown, I know I'm going over time, but I really want to get through this because I see the people are engaging, so I hope this is okay. So you want to make sure when you're fond, people pleasing, fear of conflict, and this is how this works as well. Because you're now getting this information, you're becoming mental health aware. Okay, so that means that you can now look at things and now be a safe space. So when you meet a family member and they're going through some situations, you can be like, hey, I attended this webinar and, I learned this skill or what have you. Can I talk to you about what I'm seeing with you? And the person says, no, I don't want to talk about it. Leave it alone, right? But maybe you might want to send them a letter or a card, right? But maybe you want to do something to show that warmth, okay? Okay, now we're going to go to, let's see what we have here. The healing journey. This is where I love for us to be, right? Acknowledgement and awareness. The first step toward your healing, not my healing, your stuff. This is everybody's stuff. I got my stuff, you got your stuff. Is acknowledgement and awareness. The first step in healing is recognizing and accepting that you have experienced something difficult. Let's just stop here for a minute, okay? Dr. Brown, you've known me for years, right?
For years.
And I love to talk and socialize with people. I just love people, right? Because people are so unique to me, right? I just love to study people, right? Guess that's why I majored in sociology. I don't know. But I love to study people, right? And so the first thing you have to do for your journey of healing is recognize and accept that you experience something difficult. This is an understanding of how trauma and mental health challenges affect you, identifying your emotion and giving yourself permission without judgment. Okay. Let's just be real with ourselves right now. Every person carries a story. Dr. Brown talked about the surgery in college, and I remember when that happened. I remember when you were in the hospital, right? That's a traumatic story. That had an impact, right? Someone else talked about, maybe, being a child and not being able to have enough food in the household.
Right.
Somebody else's experience may be they got married and in the marriage it was abusive. Somebody else's story that may be listening, they lost their mother, they lost their sister, they lost their daughter, they lost their child. Your experiences are your experiences, but if they're impacting your life, someone said to me the other day, I can't even look at my family member's picture that passed away. I'll be honest, I had a friend, a really good friend, that passed back in August, right? When I say that thing knocked me off my rocker, It not because that was a friend, you know, every time she would go through, she'll bounce back, she'll bounce back. So the last time when she was on this round, she didn't bounce back. And I'm like, now wait a minute, God, this ain't how this is supposed to be, because she always bounced. So then I found myself in deep grief. Okay. So in order for me to overcome and go through my healing, I had to acknowledge I am dealing with grief. And I had a trusted friend, right? A trusted friend I went and talked to. I was like, listen, I said, this thing is deep. And I was able to talk with them about that, right? And so I began to do some things I needed to do for me, because that was my friend, still my friend, right? But again, every last one of us that are listening, you may have gone through something 30 years ago, 40 years old, 40 years ago when you were 5 years old. You may have seen your parents experience whatever, right? Or you may have been in a situation where you were in a hurricane. Whatever you have gone through, that is a part of your journey. Let's acknowledge it. Acknowledge it. Then once you acknowledge it, now let's process and get support for it. Okay. Make sure you talk to a trusted adult, right? And this is for kids and adults. It's okay to seek therapy, right? You go to your you go to your optometrist if your eye's bad.
That's right.
If your diabetes is messing up, you go to your doctor. Going to see a therapist is amazing, because what you're doing, you are talking to someone who is non-biased and they're listening and giving you supports and those kind of things. And let me say this right here, Dr. Brown. Yep. Your friends are not your therapists.
Nope.
Your family members are not your therapists.
The worst ones.
Right? and I love and I talk to God all the time, right? I talk to God all the time, right? But God also created a therapist that I can go talk to him as well, right? So if you want to seek out a therapist, if you want a therapist, I'll be more than happy to help you get connected to one in your community, okay? Or there's so many spaces. And if you're not ready to go see a therapist, that's okay. But find a trusted person you can have a conversation with so they can point you in the right direction. Because here's the thing, mental illness untreated can lead to, again, physical things that can mess with your body, right? Have you ever seen people that overeat sometimes? Again, not because whatever, but some people, they're dealing with maybe depression and it's untreated, and they're eating, and now they're diabetic. Now their eye health is now being messed up. So when you think about it, and I know Dr. Brown, I talk about this a lot about adverse childhood experiences. Sometimes people show up in the emergency room because they, their blood pressure spiked. Okay, so let's find out why your blood pressure spiked. And then we begin to dig a little deeper. Oh, so you had some traumatic events that you have not addressed yet, and you've been carrying this all your life. Some of us carry so much bags. Erykah Badu, when she said, "Bag lady, you're going to miss your bus." Carrying too much stuff.
Right.
One day. So in other words, I want you all to do, for everybody on this webinar, today when you get off, unpack your bag. Find a safe person to help you unpack your bag. That's when you get growth and resilience, right? That's when you've grown and you can move forward. Self-care strategies for mental wellness. All right, so these are things you can just do, okay? Mindfulness practice. Anybody go to yoga? I tried yoga. Anybody raise the hand, try yoga? So let me tell you about yoga. I'm going to go back to Dr. Brown, try yoga again. I just couldn't do the moves. I wasn't stretching enough to do the moves, right? But I enjoyed sitting there and all of that. But when they started saying, hey, make the moves, that didn't work for me, right? So I try mindfulness a lot, right? And mindfulness, if you, for individuals that, and I don't want to tap into anybody's religious beliefs or what have you, but mindfulness, you can do mindfulness and be praying, right? So I always tell people, when you at church and the pastor say, bow and let's pray, that's mindfulness. You're centering yourself, right? So another one is physical movement. Get up and take a walk. I just joined a walking group. I'm excited about this to see what this is going to look like. But get out and just start walking, right? Just go to the park. Do something that you want to do. Social connections. Who are the people? Let me put a pin. When people tell me they don't deal with people or they don't like people, I'm concerned about that, because my concern is if you don't like people, that means you do not like yourself because you're a human. Okay. Social connections are so important. Healthy social connections are so important. Man,
Yes.
I had to cut some people out of my life because they were disrupting my peace, right?
Right.
And it's okay. Social connections. Find the people who are connected with you. Creative expression. If you're a poet, if you're a writer, if you're an actress, if you're an actor, go do it. And listen, let me tell you this right here, y'all. If somebody telling you that you're doing too much, if you are doing these things, and if you going to, let's say, if you going to yoga on Monday, if you going to the walk club on Tuesday, if you hanging out with your friends doing social connection on Thursday, if you're doing going to a poetry or spoken word event on a Saturday, and you just chilling and relaxing, and they tell you you're doing too much, continue to do that because that is for your well-being. Do not let somebody stop you from getting healthy. Someone said tapping is good. Not sure what tapping is. I'm
thinking tap dancing.
I was thinking tap dancing too, Tim. Brown. I was thinking tap dancing. But if it's tap dancing, I'm gonna get me some tap dances. And if that is helping you, I'm gonna try it out, right? If it's helping you tapping, so whatever tapping is, if you can put in a comment what that is, because Dr. Brown, I want to know what tapping is, okay?
Exactly.
But Dr. Brown, I want to talk about that last one. It says rest and boundaries. So this goes back to the family, right? I often hear people say, you can choose your family, you can choose your friends, but you cannot choose your family. Is that factual? I can choose my friends and I can choose what part of my family I deal with, right? Just because we're families, I'm still going to have boundary to you as well. I don't care who you are, because if you're disrupting my mental health, my well-being, I'm going to have boundaries with you. It does not matter if it is I'm the baby out of my siblings, right? I'm the baby. And because I'm the baby, I play on that a lot, right? But sometimes, they forget that I'm grown as well, right? Right. They still treat me as a baby of the bunch, and I have to let them know, I'm grown, right? I have boundaries. No, you're not going to talk to me that kind of way. We both grown, right? And also boundaries are going back to what you said. If you don't want to have your kids in an unhealthy environment, you don't have to take your kids over there. However, are you willing to work on the relationship? And to work on the relationship, both parties have to be willing to work on the relationship. I know some individuals that do not talk to their parents to this day. And I was like, well, let's talk about that, right? Let's talk a little bit about that. And they'll often say is that my parents won't take accountability. They keep telling me I need to get over it, those kind of things or what have you. And so that may be unhealthy, but you can still respect your family, still value your family, but it's okay to have boundaries with your family. It's okay. Somebody put that in the comment. It is okay to have boundaries with your families. Mr. Mark, we still want to know what tapping is, okay? Because we really want to know what that is. Building your support system. Dr. Brown is one of my support systems. Dr. Brown and I have been friends to this 26 years.
26 years, baby.
26 years, right? And not only is Dr. Brown my good friend, but his wife, Dr. Brown, is my good friend as well. I can call and talk to both of them at any given time. We're friends, right? Well, I'm gonna say we're family, right? Yeah. Sometimes friends become family. And so building your support system, this is so important, right? This is homework for you all. I would like for you all to build your support system. Who is that one trusted friend and family that you have? What is a peer support group that you can join? My business will be starting a support group in July, I believe. That's going to be focused on being a safe space. It's going to be a space where you just come and have fun, right? As a peer support space. Crisis helplines. It's okay to have these emergency numbers on your phone, on your door. I've been in some people's house and they have a thing that says emergency scriptures. That's nice. Have emergency scriptures, right? I have it on my refrigerator. But also, who are the emergency people I can call? Okay. Professional resources, chapel therapy, community organizations. One thing that I do sometimes when I find myself, going back to that continuum, when I find myself like feeling my mental health like just drained, I do a sticky note thing, right? I have a whole pad of sticky notes, and every morning I get up, I'll write something on the sticky note. Jason, you're great. Jason, you're wonderful. Jason, your past does not determine your future. And I'll have a sticky note, and now that's what I will live by for that day. So he said, tapping is EFT, emotional freedom technique, psychological acupuncture, gentle tapping on specific parts of your body while focusing on, oh, wow, that is pretty cool. Dr. Brown, we're going to try tapping.
Wow.
Put that on. Can our producer put that up there so people can go and tap it on that? Yeah, put it up there so you can tap on. That's cool. While tapping, you identify an issue, saying grounded statements while tapping on specific parts of your body while repeating the phrases. Wow, wow, that's super cool.
Yeah.
Thank you for sharing that.
Thank you. See, it's a learning opportunity for all of
Right.
us.
And in
Thank
order
you.
for us to heal, Dr. Brown, this is what we got to do. We got to break the stigma.
Yeah, the break.
Challenging misconceptions. Mental health conditions are not a sign of weakness or personal failure. They are common, treatable, and affect people of all backgrounds. It does not matter who you are. So again, let's remove the stigma from talking about mental illness. And I'm gonna be real, when I'm around even some of my families or whomever, my own family, or even some of my friends, when they begin to have conversations about a family member or a friend or what have you, regardless of something that they're going through, I will excuse myself from that conversation. Or sometimes I'll even like, no, we're not going to do that because you don't know that person's story. And so I've had people get mad at me. I'm like, no, let's start healing. Let's start helping people. If we help people, we can achieve so much more in life. Create a safe space.
Right.
And I want people to, and I think you put that up there. If you can ask this question, are you a safe space? Let me tell you, Dr. Brown, you know, I learned at an early age what a safe space is and what a safe space is not from people. Okay. I can remember growing up and I can remember hearing somebody who was going through in their life. And I could remember hearing older adults just bad mouthing these people, right? And I was saying in my mind as a young person, that's not a safe person right there. Because how can you do that, right? So creating a safe space is the person. Are you a safe space? Can someone come and have a conversation with you, not feel judged, feel heard, feel encouraged, feel positive energy, and leave trusting the space? That's why I tell people, it's okay to go to therapy. If you feel that you don't have a safe space with people, go to therapy. They're bounded by confidentiality. They're bounded by HIPAA. All of these things of that particular nature. And so another piece is sometimes people who are safe spaces for us, that's great, but we may need a little bit more, right? You may have somebody that you can go and talk to about your issues and your concerns, but you also may need to go to a psychiatrist, maybe to get some medication, right? Just like we take blood pressure medicine to lower our blood pressure levels, right? You may need to take a psychotropic medication to balance you out, okay? And it's okay. So creating a safe space. Are you a safe space for somebody? Are you a safe space for somebody? You can say yes or no. Or matter of fact, if you're not, just own it. Just own it, right? And we're actually going to have a training that's coming out soon that's focusing on that. So I will definitely tell individuals they're interested in being a safe space. We'll be able to provide that training. How to support someone. What you say, I'm here no matter what. What to avoid saying. Just think positive and you'll feel better. Stop that. Because I can think positive all day, every day, but my situation has not changed, right? You just need to get over it. I know exactly how you feel. No, you do not know how I feel because our pain.
That's the worst thing that people can say.
Say to me, like, you don't understand my story.
Right.
You don't understand my pain.
And just because we brought that up, Jason, if you're listening to this, I want to encourage you to never say this to someone who has lost a loved one. I know what you're going through. I know how you feel. You have no idea how that person feels because you don't know the relationship that they had with their mother, their father, their sister, their brother, whoever that loved one is that they lost. So sometimes the best thing is just to say, I'm here to listen. Whenever you need me, I'm here for you. Sometimes those are the best words that you can utter out of your mouth. But please stop going to these setting ups and going to the funerals and saying, I know what you're going through. I know exactly how you feel. No, you do not.
Exactly. At all. And the other one that what kind of taps me, Dr. Brown, is the one that says, you don't look like you struggling.
Man.
I know homeless people that look homeless, but they're not struggling. Right. And so stop telling people that. And the one that says avoid minimizing their experiences, that is the worst thing you can do. You will shut a person down when you minimize their story, right? When someone tells me, prime example, and we have to talk with this. There was a young man in my church. He was about maybe 4 or 5 years old, and he was running around and he fell and bumped his head on the side of the pew at church. And he sounded off and he cried. He had a big lump on his head, right? And one of the brothers in the church picked him up and was like, stop crying, man up, stop crying. And something inside of me, I don't know if it was like I put my Superman cape on, but I'm like, hey, bro, no, let him cry. He's hurt. He's hurt. He was like, I don't want, he don't need to be crying around here like such little boom, 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 boom. And I was like, let me explain to you what you just did. When he gets 16, 17, 18, 19, and 20, and you always asking him, why are you so angry? Why are you so? Because you told him at 5 years old to suppress his emotions. You told him at 5 years old his feelings did not matter. You told him at 5 years old that pain that he's enduring does not matter, right? That's like me telling I'm telling somebody who may be job hunting, and I'm gonna say, well, you know what? Well, this all you gotta do, get over it, right? No, I don't know. So in other words, value a person's story. When somebody tells you something is going on with them, they are giving you a golden nugget. They're giving you a part of them. Are you going to honor what they gave to you? That's why we have to flip our conversations to what to say and what to avoid saying. Okay. Yeah. I may need to do a whole presentation on this.
Whole presentation, man, because when you say that, yeah, I just want to say, Dr. Mahoney, when you tell that child, man up, stop crying, that stuff carries over into their relationships in the future.
Right. That goes back to what Noel Summer just said, about how these things impact your relationship. They can, because what happens is, I did domestic violence work for years. And so what I learned in a lot of those groups is a lot of those offenders had a lot of childhood trauma. Right? And so we had to go back and heal. I remember had to go back and heal the person who they were when they were 5 years old. One of the saddest things is, but it gives me hope, when I see somebody who is 60 years old, 70 years old, showing up for therapy. Because if you think about it, especially in the African-American community, we have the highest disparities, right? If you think about it, if you're 70 years old today, right? What year were you born in, Dr. Brown? If you were 7 years old, what year were you born in? I'm a social worker, we don't do math.
So you're
2019. Yeah. Right? No, I did that wrong. 2026 minus 70. I was born in 70. I was born in 1956. Yeah, we did that right. So I was born in 1956, right? What was going on in the world in 1956, right? You had racism. You had, separate but equal. You had all of these things, right? And so you have that, going back to that trauma. Then you also had families growing up in poverty. You had families that did not have access to care, all of these things. And you had situations where children should be seen and not heard. I tell people, I grew up in the area, children should be seen and not heard, even though I didn't grow up in 1956. And Dr. Brown, I think you grew up in the area as well. Children should be seen and not heard. That is baloney that we need to take the trash, throw it away. Yeah. Children should be seen and children should be heard, right? Yeah. And children should be taught how to show up and how to be heard. That's the difference. We need to show children how to show up and how to be heard versus telling them to shut up, right? Because in 1956, so when I see somebody 70 years old and they said, I'm going to therapy, or they say, I'm healing myself, I love that, because if you think about somebody who's 70 years old, somebody who's 60 years old, the pain that they are carrying because they grew up in a system where it was oppressive, it was racism, and that's just one part of trauma. We don't even talk about the trauma of you 14 years old and you had to get married to somebody that you didn't want to get married to, right?
Yes.
How many people are in these marriages now where it's like, wait a minute, I was forced to marry this person.
Wow.
I had, and then next, so again, when I see grown people, and I say grown people showing up and addressing their mental health and their mental illness, I'm like, what? How can I support you? Because if we do not heal our community, we will be hurting. Mental health resource, we talked about it. Therapy, counseling, hotlines, online resources, taking action for mental health. Start with yourself. Mind your business. Start with yourself first. Okay. Reach out and connect with people and advocate and reduce stigma, right? Once you have healed, now let's advocate for someone else, because again, communities that we grow up in, we may not be able to talk about those things. Your next steps, connect with someone. Let's continue this conversation. And so the last thing that I want to do is I want us to be able to see Dr. Brown this video here. Okay. And then I'm going to end on this video, but I want us to watch this video because I want people to see how trauma impacts one mental health. Okay. This is a very challenging video, but I definitely want you all to watch it, and we can process after it. Okay.
Let's do it.
I honestly can't even believe that I'm here. I'm typically able to keep it together and hold things down. It's actually kind of embarrassing. You see, I honestly don't think I fit the mold of someone who needs therapy, but my job required me to attend at least 5 therapy sessions before returning back to work. I excelled through grade school and graduated at the top of my class. As I told you before, I'm not your typical client. I like to think of my clients as family. I want what's best for them just like I'd want for my family. My firm has never had any concern regarding my passion, until recently when I had one of my toughest cases, which is why I'm here having these sessions with you. You see, I had a breakdown. A breakdown. That doesn't even sound right coming from my lips. I've always been able to separate emotion from the job. This was one of the most troubling cases I've ever had. It involved a middle-class African-American family, and the couple had 4 children, 2 girls and 2 boys. The youngest son, Kevin, is the reason they came to my office. He's 8 years old. The family was pressing sexual abuse charges against their pastor, his wife, and their 26-year-old son, Larry, as well as his wife. Kevin was sexually abused by Larry during Sunday school, vacation Bible school, church summer camps, and any other time they were left alone. On one particular occasion, Larry's mother walked in and witnessed the abuse. She ran to the pastor and they agreed to keep silent on the issue, and they didn't want that to affect the image of the church. Kevin's mother heard him just crying uncontrollably one night. She went in to check on him, and that's when he revealed everything that had happened. She remained calm, then she ran to her husband. Her husband cursed and screamed, "I'm going to kill that man!" She calmed him down and convinced him to handle things appropriately. That next morning, they both talked to Kevin, and he revealed when everything had happened and what had happened and why he didn't say anything. When they approached Larry and his family, they all denied everything, which is why they came to my office. Kevin had to share his story again, and this time it was recorded. To my surprise, the question and answer session went well. I was so impressed with this young man. He was not afraid to tell his story. He even said, "I don't want to get Mr. Larry in trouble. He's a nice Sunday school teacher." The bravery of this young child. At 8 years old, he was able to handle a traumatic situation better than some adults. I ended the session with his family, and I informed them that I'd be doing a follow-up with Larry's attorney. As I walked them out the office, I walked back to my office in tears. How could someone do something like that to an 8-year-old kid? How morally wrong of the pastor to cover up the behavior of his son while a child is suffering. On my way home, all I could think about was the hurt in Kevin's eyes as he told his story. I had several drinks that night to cover up the anger and the pain I felt for this man, and how he had just tore his life all upside down. The next morning, I attempted to work on Kevin's case at work. But the more I wrote, the angrier I got. And before I knew it, I was screaming and throwing things across the office and turned the desk over. My office mates came in, they tried to calm me down, and I just got louder. I just screamed, "Why? He was just a kid." He was just a kid. They tried to calm me down some more. I just kept kicking and punching holes in the wall, and eventually they called security to de-escalate the problem. And once I calmed down, my boss called me into his office. "Cedric, what's going on?" I informed him that my recently assigned case of an 8-year-old kid being sexually abused had frustrated me. He informed me that I couldn't come back to work until I had a psychological evaluation and counseling, which is why I'm here. I had a break. You see, Kevin's case had triggered me and triggered events that I had dealt with in my childhood. I was Kevin from 6 years old up until I was 14. Nobody rescued me. I had to rescue myself. Nobody knew my childhood trauma. For 35 years, I kept this dark secret. I never told anyone. I never told my mother, my wife, or any of my friends. I was mad at them. I was mad at them because I felt like they should have known. Unlike Kevin, it was my mother's brother, an older female cousin, and a man in the community. During my teenage years, I used women just for sex. Throughout college, I was very promiscuous with older women just to prove that I was a man. Even in my marriage, my manhood was still suffered because I felt like I had lost that at 6 years old. I have to have sex with my wife multiple times a week, just to prove that I'm a man to myself. Hell, I've had multiple affairs with women just to say that I'm a man. My kids. I'm overprotective of my kids, and I won't let them be kids because of my fear. I wasn't ready for a case like Kevin's. It opened wounds, and I had them hidden, and I wasn't ready to deal with them. I was angry. But not at Kevin's story, but I was angry because at 8 years old, he had the strength and the courage that me being 41 didn't have to tell my story.
That's deep.
Wow. So, wanted to show that video at the end because I want individuals to realize that we talked about mental health, we talked about mental illness, and we talked about the different types of trauma that people endure. Okay. And so you saw this individual, and what we saw in this video is everything that we talked about today. Dr. Brown talked about we can see people and we do not know their story. Okay. And then we see how trauma shows up in a person's day-to-day life. He spazzed out, right? How many times have we interacted with people and they may do some behaviors, and I use the word spaz out, but they may demonstrate what I call a trauma response. And then we judge them based on that versus saying, we'll say, what's wrong with you? No, not what's wrong with you, what happened to you? So if we can change our languages, so when we think about our own family and when they're doing different things, do not ask them what is wrong with you, because when you say something is wrong with you, that means you're deformative, you're defective. But if you say what happened to you, then you can have a better understanding of how to interact with that person, okay? And so I do want to say that that is actor Kevin J. Stone. You can Google him, go and look at some of his things. Phenomenal person, a really good friend of mine. And what that clip is from 5 years ago. And Dr. Brown, I don't know if you ever knew this or not, but 5 years ago, I released a movie called Tried in the Fire. And so that is one of the clips from the movie Tried in the Fire. And I just realized playing this today that this is the 5-year anniversary of Tried in the Fire. I released it in June. So I'm thinking I am going to do a video launch of this again on a 5-year anniversary so people can truly understand what mental health is, what trauma is, what mental illness is, and how do we build resilience, because we're able to do this. So I'm actually going to stop. This is a long webinar. I hope I get invited back. But one thing I can say is that the people stayed on, the number stayed the same and kept going up. So I appreciate everyone for listening to this most important webinar for Mental Health Awareness Month. And I also want to tell people, you all see the Cash App that is going on the screen. That's not my Cash App. That is the Cash App for the National Optometric Foundation, which is a nonprofit organization that focuses on eye health, eye well-being, helping individuals, matriculate, going to school, to be optometrists, etc. So my ask to you all is, I want to thank NOF and Dr. Brown for allowing me to be here, but I would like for everyone to at least make a donation today. That is a $, and it is all tax deductible. Please support grassroots organizations. That is community development. That is how we address mental health, mental illness, and mental wellness. So again, please support this organization. Turn it back over to you, Dr. Brown. Thank you, and thank everybody for engaging. You can reach out to me. You can email me at info@craftedtomotivate.com, or you can, matter of fact, you can just Google Jason T. Mahoney, and you'll be able to find me in different methodologies. Just Google me or send me a message on the here, and then you'll be able to be added to our mailing list to get an invite to this group that we're about to start, so we can start healing the community. So thank you very much. Enjoy being here. Dr. Jason T. Mahoney, better known as the Motivator, and let's get healthy. Thank you very much, Dr. Brown.
Thank you, Dr. Jason T. Mahoney, the Motivator. Y'all show some love in the chat. Show some love for Dr. Mahoney. We thank you for being our guest speaker tonight and discussing an important topic, a topic that affects all of us, whether it's in your family, your coworkers, your church, or your community. We're all affected, and we all need to be more aware in how we approach people who are dealing with mental health issues there. So thank you for those nuggets that you share with us tonight. And we will have you back in the future on another webinar. Thank you so much. And thank you for the love that you guys are sharing in the comment section there. So as we close tonight, just reminding you guys, we are the National Optometric Foundation, nonprofit organization supporting our future optometrists. Those are in school, thinking about going to optometry school, in high school, and those who are currently in optometry school, supporting our National Optometric Association as well. And like he said, please donate to allow us to continue the great things that we're doing for communities, underrepresented communities, providing eye exams and resources, eyeglasses to communities as we travel, serve where you go, bring awareness on the 3 silent killers of your vision: diabetes, diabetic retinopathy, and hypertensive retinopathy as well. Our Cash App is $ protecting the vision. We do have a website, www.nationaloptometricfoundation.com. You can also go on our Facebook page and follow us there, and also on our YouTube channel. You'll see these webinars on there. As we close out tonight, I just want to remind everybody that your mental health matters. Your voice matters. Your life matters. No matter what challenges you may be facing, you do not have to carry these things alone. There's strength in speaking up and seeking help, and courage in seeking that help, and hope and healing, as Dr. Mahoney talked about tonight. So let tonight be more than just a conversation that we're having. Let it be a reminder to check on one another, show compassion is what he's talked about, and give ourselves some grace as well. Sometimes the strongest thing a person can simply say is, I need support, so don't be afraid to reach out for support. Thank you guys for joining in. Thank you for being interactive in the discussion as well. Our YouTube listeners, wherever you're listening from, learning with us, helping break the stigma around mental health. May we leave tonight more informed, more understanding, and more committed to creating a world where people feel safe, where they want to be healed, where they want to see growth, and they want to be heard. And always remember, healing is possible, hope is real, and brighter days are ahead. Continue to stay positive, and thank you for allowing me to be here with you on this webinar. We're looking forward to seeing you on our future webinars. My name is Dr. Timothy Brown, board member, director of the education for the National Optometric Foundation, and I hope you have a great evening. Thank you.